So it's 1st January 2026. Yes, and we are back to study medicine. And yeah, it's New Year. So Happy New Year. Let's just focus on the things which are important in life and fuck off the remaining things. One thing which I'm very sure of this year is I'm going to be the baddest bitch alive. I don't give a shit to people's shit. And I am literally not here to entertain the fucking people. Fuck off. Literally. I don't give a shit. And people are messaging, I don't give a shit only. So yeah, that's all. And focus on the things which really matter. Okay? That's it. So yeah, we were at the thyroid disorders, diseases of thyroid. So a patient with thyromegaly has been referred to surgery. Intraoperative, there is manipulation of gland and persistent sympathetic stimulation, that is increased T4 and T3. Heart rate increases, high output, congestive cardiac failure, BP crashed, and crepitations are positive, SpO2 fall, calorigenesis, and there is temperature increase. So this presentation is pre-operative illness, intraoperative complications of thyroid surgery, and radioactive iodine ablation. The treatment is switch off IV fluid and blood transfusion if congestive heart failure arrhythmia is documented. The drug of choice is propylthiouracil. Mechanism of action is it inhibits the conversion of T4 to T3, nasogastric tube or rectal route. Alternate drug is methimazole, it can be given, and propranolol, it prevents increased heart rate and calorigenesis by blocking beta receptor stimulation. And esmolol, it prevents further increase in heart rate, as propranolol should be avoided in heart failure. Hydrocortisone, it spikes the level of cortisol and inhibits the conversion of T4 to T3. And cholestyramine is sequestration of thyroid hormones. Prevention is give a saturated solution of potassium iodide or glucose iodine preoperatively. It can also be used intraoperatively. Saturated solution of potassium iodide. Saturated solution of potassium iodide, that is also known as glucose iodine. Then SSKI is saturated solution of potassium iodide for 10 days. It causes shrinking of gland. Surge of T3 and T4 will be less. And it decreases iodine trapping, decreasing T4, then it leads to decreasing T3. And it demonstrates a Wolff-Chaikoff effect, further prevent the further formation of thyroid hormone by downgrading iodine trapping. What is Wolff-Chaikoff effect? Downgrade करते हैं iodine trapping को. Clinical features किस चीज़ के thyroid storm के. तो thyrotoxicosis is fever, CNS में delirium, coma, seizures, CVS में arrhythmias, nausea, vomiting, liver में jaundice, cause of death is due to CCF, arrhythmias. Primary prevention is mechanism of action is Wolff-Chaikoff effect. Scale for thyroid storm: if the value is more than 45, incidence of thyroid storm increases. If less than 25, chances are lesser. Then Jod-Basedow effect, seen with an intake of iodized salt for longer duration. So there is increase in iodine trapping, increased T3 and T4 production. So intake of iodized salt, if it is for a long duration, then there is increase in iodine trapping, so increase in T3 and T4. It's a thyrotoxicosis. So saturated solution of potassium iodide, large dose of iodine for 10 days in yoga, then decrease iodine trapping, so decrease in T4. That is Wolff-Chaikoff effect. And iodized salt is minor doses of iodine for years, and there is increase in iodine trapping. That is Jod-Basedow effect. Then there is thyrotoxicosis. Factitia is exogenous, intake of cattle or beef meat containing thyroid gland of an animal. This leads to palpitations and heat intolerance. Thyrotoxicosis occurs due to causes which are other than high salt intake, obesity, consumption of Ayurvedic containing levothyroxine, increases BMR and weight loss. A lot of these are marketed as weight loss medication, which are nothing but levothyroxine. Then thyroid hormone excess heart rate increases, oxygen consumption with increase, which leads to angina. Then hyperthyroidism, increased function of thyroid gland. Thyrotoxicosis, there is excess of T4 level. Then thyrotoxicosis without hyperthyroidism is seen in subacute thyroiditis, silent thyroiditis, thyrotoxicosis, factitial, radiation, immunodermal infarction of large tumor. Then causes of hyperthyroidism in primary hair, secondary hair. So primary hair most common causes Graves' disease. Graves' disease have LATs, that is antibody. LATs antibody होता है long acting thyroid stimulating antibody. So long acting thyroid stimulating antibody है. So TSI is TBII, thyrotrophin binding inhibitory immunoglobulin SA, and TSI is thyroid stimulating immunoglobulin will mimic TSH. So T3 T4 will increase होता है, then TSH it will be reduced. Then secondary में due to pituitary adenoma, excess synthesis of TSH. में यहाँ पे T3 T4 increase हो रहा है. This is toxic multinodular goiter or toxic adenoma. activating mutation of TSH receptor, thyrotoxicosis factitia, Jod-Basedow effect, stroma ovarian, gestational trophoblastic neoplasia. Hot nodule is increased uptake, cold nodule is decreased uptake, and iodine used for scan is iodine 123 or iodine 132. Sustained hypertension होता है इसमें. Lead retraction is due to contraction of bullous muscle. Lead lax sign or steer sign is the earliest feature. Inability of upper eyelid to follow the object from top to bottom. And inadequate blinking leads to exposure keratitis. Varictis is the most common extraocular muscle involved. Diplopia, retrobulbar neuritis. No signs and symptoms, only signs है soft tissue involvement, proptosis, extraocular muscle involvement, corneal involvement, sight loss. Acropacky. So then there is Pemberton sign on raising arms. There will be facial congestion due to compression of superior vena cava by retrosternal goiter. It tells about the retrosternal extension of goiter. Compression of superior vena cava में congestion of face, facial congestion होता है. TSH is severely reduced in primary hyperthyroidism, that is Graves' disease, and next investigation will be TSR, thyroid stimulating immunoglobulin. If increased or normal, then pituitary adenoma. Next investigation will be MRI of head. And subclinical hyperthyroidism is normal levels of free T4 and T3 and decreased level of TSH. And treatment of Graves' disease, there will be spontaneous relapse or remission, also the possibility of fluctuation of free T4 levels. Then there is methylprednisolone is given, initially worsened, but then improvement is seen. And treatment of choice for Graves' disease is radioactive iodine, contraindicated in pregnancy and breastfeeding. Then antithyroid drugs may PTU, propylthiouracil is safe in pregnancy first trimester. And black box warning होता है because it is hepatotoxic on prolonged use. And carbimazole है safe in second trimester, iatrogenic effect है aplasia, cutis and corneal atresia, drug of choice. The propylthiouracil and carbimazole. Dose-limiting side effect of antithyroid drug is agranulocytosis. Agranulocytosis. Then treatment of secondary hyperthyroidism is due to pituitary adenoma with gross increase in TSH. Treatment is transsplenoidal surgery. Isolated diastolic hypertension. हाइपोथायरॉयडिज्म में वाटर बॉटल हार्ट और मनी बैग अपीयरेंस होता है. सेल्यूलेटेड एथेरोस्क्लेरोसिस तो हाइपोथायरॉयडिज्म में करना है. SLE, DM, CRF, CKD, hemolysis syndrome, nephrotic syndrome. Levothyroxine ले सकते हैं. स्पेस ब्लैंकेट. का कॉर्टिसोल रिलीज करता है, जो स्ट्रेस हार्मोन होता है। मेडुला कैटेकोलॉमस, प्राइमरी इंग्लिश बायलैटरल एड्रिनल हाइपोप्लेसिया,